We're going to start with a look through the lens of public health and safety. So it's important to know what it means when we say public health.
It's not healthcare exactly. Public health uses a scientific approach to examine an issue across multiple disciplines, including medicine, epidemiology, sociology, psychology, criminology, education, and economics.
It's a three-step process. First, gathering data is crucial to defining and monitoring the problem. Then that data is used to identify root causes and risk factors, and to develop preventative measures. Finally, public health professionals promote the widespread adoption of intervention programs.
In the 20th century, public health programs followed this approach to eradicate smallpox and polio, make factories safer for workers, reduce tobacco usage, and improve driving safety.
Can you believe motor vehicle fatalities were cut in half over the past 50 years? That's not because of any one thing. It's the combined effect of seatbelts, infant car seats, laws against drunk driving, and more. Taken together, it's an outstanding win for public health.
This is the kind of work that leads to actions big and small, from neighborhood interventions to large-scale public education campaigns.
And gun violence is a significant public health concern across the United States. In 2020, 79% of homicides and 53% of suicides involved firearms. And those numbers don't even capture the full impact of the social, emotional, and mental health trauma borne by children and adults exposed to gun violence.
And there are financial costs too. Gun violence injuries cost victims more than $1 billion every year in direct medical costs alone. Increased school security measures in response to gun violence, that's another $3 billion every year. And gun violence in the news can hurt local economies by slowing business development and decreasing housing values.
A public health approach has proven effective in countering crises like this in the past. But when it comes to gun violence, this kind of collaborative scientific approach is not employed as often as you might think.
So, what could work? We have 3 actions for you to consider.
First, did you know more than 80% of shootings go unreported? This is because of what's been called the culture of silence.
Violent perpetrators have been known to target citizens who come forward as witnesses. Many fear retaliation if their name was ever associated with police reports of gun violence.
One potential solution is a system that would allow community members to make anonymous reports to police, report about people having suicidal thoughts or drug sales, criminal activity, or gun violence.
Tips could be monitored by local law enforcement, school staff members, and community-based health organizations working together.
Most crime in a community is committed by a small number of people. Anonymous reporting can help identify those individuals and give police better access to timely and accurate information. Supporters hope this could become a deterrent to gun crimes in the future and lead to greater trust between communities and law enforcement.
But some caution that an anonymous reporting system might not be enough to change the culture of silence and intimidation that keeps people from snitching. Others worry about the potential for false reporting and the cost of the additional manpower needed to handle a sudden surge in reports.
The second action we'd like you to consider has to do with addressing trauma and mental health. 60 million adults and children in the United States live with some kind of mental health condition. And according to the National Alliance for Mental Illness, half of them receive no treatment for their illnesses. Those 30 million people carry a higher risk for harming themselves or others than the rest of the population.
So, one proposal to decrease gun violence is to provide federal funding for mental health services not covered by private insurance or Medicaid, Medicare. That might include medical and counseling services through partnerships with schools, hospitals, churches, and community centers.
Just one quick note. Although there are links between mental illness and gun-related suicides and homicides, most people with mental illness do not commit violence against others. Some studies suggest they might actually be at greater risk of becoming victims of interpersonal violence than becoming violent themselves.
Supporters believe that increased access to trauma interventions and mental health services could reduce gun violence across the board, with measurable effect on gun-related suicides, domestic violence fatalities, and mass shootings.
But while mental illness may be associated with gun violence, it's not the sole cause, nor does one automatically lead to the other. Only about 4% of violent interactions in the United States can be solely attributed to serious mental illness, so addressing mental illness may not have a significant impact on the problem.
Others are concerned that these mental health initiatives around gun violence could stigmatize the mentally ill, leading to harmful stereotypes without actually solving the problem. There's also concern that people with mental illnesses will not use the services even if they're fully funded.
For our third action, we're going back to the start of the public health approach and the need for good data. What if Congress provided regular federal funding for research into public health gun violence prevention?
In 1996, Congress passed a law prohibiting the use of federal funds to advocate or promote gun control. That law, the Dickey Amendment, had a real chilling effect on federally funded gun violence research. How much? Well, in 2017, a study found that the federal government spent $63 on research for every life lost to gun violence, while at the same time spending $183,000 on AIDS research for every death related to HIV.
That's a lot more. In March 2018, Congress clarified that the Dickey Amendment does not restrict federal research into the root causes of gun violence. A year later, Congress allocated $25 million for that purpose. But after 2 decades of minimal funding, many worry it's not enough.
Some say there's not enough data available to know what strategies for reducing violence are actually effective. They'd like more research on which solutions work best and how to create better monitoring practices. They believe a reliable multi-year federal funding stream is necessary to avoid interruptions in this research.
Of course, research costs money, and many are leery of adding costs to the national budget. Some believe there's no way the data can be gathered in a politically neutral way and could be biased in favor of gun control. Others think that research is not useful if Congress can't be counted on to act on the data and would rather see funding go to direct solutions that have been shown to work.